don't quit when you don't pass the audition, when you're told no, because if you quit when you're told no, when you're told no, when you're told it's not your time, not you right now, if you quit then, it was never your dream to begin with. Welcome back to the Samantha Show. I'm your host, Samantha. You can call me Sam, just don't call me Sammy. And I'm really excited for this conversation today, not only because I have my whole list of medical history ready to be reviewed, but I'm actually here with Dr. Lauren Frost, and she is a cardiologist down in Miami, Florida. That's why she's sending the sun up here to us in Ohio. And Lauren, I'm so excited to have you on the show. Or should I just call you Dr. Frost? I feel like, is that better? What do you say?
No, whatever you prefer. You can call me Lauren. I mean, this is a casual conversation. But we'll talk about, right, women and how women are, like, automatically addressed as their first name. Without asking. The fact that you asked is all I care about. It's really kind.
Isn't that amazing? You know, that was something I didn't even make the connection with, but now that you say it, you're absolutely right on that. Just even thinking about, again, I've got kind of a laundry list of doctors, cardiologists, endocrinologists, hematologists, oncologists. We could go through. But you're right. Like, historically, there seems to be some connection here. So I do have Dr. Frost on. I'm going with, like, the very proper name here because I think you deserve it.
Thank you.
We're going to talk about women in male-dominated fields. It's part of that series that I'm doing right now. And now you can correct me if I'm wrong here. I tried to pull up a couple little facts before we got on here. So from the National Library of Medicine, it says that only 15% of cardiologists are women.
Absolutely.
Does that sound in line with what you've experienced?
I mean, generally speaking, I think I'm a little more blessed in that a lot of where I've come from in my training is a little bit more open-minded. And even though we're, in Florida, I do surround myself with women cardiologists. And, like, definitely not. I mean, we're a practice of, depends how you look at it, but like 25 doctors. 4 of us are women.
Wow.
So it's probably about what you're seeing with the statistics. It's definitely been my experience in cardiology. Not necessarily medicine in general, as you well know. But yeah, no, I think it's an accurate stat.
And not only are you a cardiologist, but you're also a mom. And that's something that I want to talk about because I'm so grateful that I could get a little bit of your time to talk to you because I just envision not only doctors, but a doctor like a cardiologist to be so busy. And you're not only saving lives and focusing on the heart, so important, but you're also a mom and you're juggling 3 beautiful little girls. So tell me a little bit about yourself.
All right. Well, when I was starting off to be a doctor, I was like 25, 26. You know how immature you are. I'm now 43. So I'm a different person now than when I was deciding to go into medicine. It kind of seemed like the natural thing for me to do at the time. I always excelled in school, particularly math and science. I was always up for a challenge, a little bit of type A, if we're really being honest, right?
Sure.
So it was kind of like one thing led to another. I worked hard in high school, got into a good college, worked hard in college, I was surrounding myself with really a lot of overachievers, and I think that would be something I would take home, right? You were asking for advice. Surround yourself by people who bring you up, not just emotionally, but academically, who challenge you to be the best version of yourself, right? A little competition is healthy. So, and then I went to medical school, and it's challenging, of course. The whole thing about medicine and this perspective I have of this wise old lady now is that things have changed a lot during my practice. And you have to be pliable as a human and open to change. And a lot of people are not, especially not much older than me and you. But so I've been able to, because I guess I'm pliable, take advantage of the changes in technology and all the new medications that we have that make people's lives better and healthier. And so that's been great. What motivated me to be a cardiologist was that, I mean, everyone's motivated by like their own personal experiences. My dad, and I didn't even perceive this when I was in high school, but he had his first stent when I was in high school. He was young. He was like 47 years old. That's quite premature in the world of heart disease. Unfortunately, our Eastern European roots, and this is genetics, and he wound up having disease that was probably 15, 20 years ahead of his time. He's alive still. He's got his issues, but from a cardiac perspective, I think that's why I was more interested in treating somebody that was like my family.
So let me ask you about that process. At what point do you decide where you're going to specialize?
You kind of have a general sense in medical school about if you want to be a surgeon, if you want to be more of a diagnostician, like I am. If you're interested in certain specific parts of the body, if you want to do general, more specific. To become a cardiologist, though, you have to go through internal medicine training, which is the route of many of the subspecialties that you mentioned: endocrine, GI, hematology. Those are all internal medicine training, cardiology being one. So that's how I went first after medical school. Then you go to internal medicine for 3 years. I lived in Boston for 3 years, and then came back to Miami for my cardiology training, and that was another 3 years. So you're looking at, after college, like 10 years investment in time, which, it takes its toll in some respects, right? Here you are, your body's aging, you maybe haven't started your family, you sacrifice, but that's medicine in general, not just women, but women have that clock ticking when men really don't as much. So, that was a factor.
So let's talk about that factor. So you do have 3 girls at home. So you were, I'm trying to think of the timeline we talked about before we started the call. So you were actually already in your practice cardiologist by the time you started your family.
Yeah, you did your math really good, really quickly. So I was married right before I started in my private practice about 11 years ago. And then, like I say, I'm actually considering myself very blessed because there was one other female cardiologist working in this practice when I joined at that point, and we've hired more since then. But the managing partner in my practice is very open-minded. He is very progressive, and he made it a doable, pleasant experience to be a female practicing in his practice. He realized that women bring something extra, something different. I can't tell you the countless times I see, and patients will verbalize, we wanted a female cardiologist because we tried a male cardiologist and they don't get it, and I'm going through menopause, they don't get it, and I hear it time and time again, and I just nod and smile, and I know, because we actually have a women's cardiology clinic here, and my 3 other female cardiologists are on the same page, like very passionate about certain issues that only women go through within the cardiology realm. I haven't said this, but all along the way, I'm working my butt off, right?
Sure.
And maybe even a little bit harder to compete in this male field, right? But then I want to have my babies. Of course, I always wanted to have children. I worked till the day before my scheduled C-section for each of my 3 children, and eventually became big and swollen and gross, but just worked, and for the most part accepted by the patients, most part accepted by my partners. So then you have to think about it, right? So you have the baby, you have maternity leave, that's not paid. So you're not getting your income and your investments along the ways that you should be, that you're probably 10 years behind on some of the peers who have already started investments and savings for their 401k. Come back from maternity leave, and I breastfed all 3 of my babies.
Wow, yeah.
I did. It was really important to me. So what does that look like? That looks like in my office with a breast pump for a full 9 months, locking my door with my little sign that says, do not disturb, pumping 3 times a day at my long, 8 to 5 job.
Wow.
Breast milk covered in my office, once in a while I still see little spots of it, because now my youngest is 3.5, so I actually consider myself in a very things are a little easier in some respects now. My youngest at 3.5, she can fend for herself, she's verbal, no more diapers. For a while, it was really hard. It was really in the trenches, different hard. Now they require a lot more interest and stimulation and activities and logistics. Sure. But, working through all of those phases, you have to be in the right environment as a woman in cardiology. And I think my partner he didn't make anything easier. Like I said, I didn't have income when I was on maternity leave, but you save, you plan, you have insurance or whatever. But my job was there when I came back. My patients were there when I came back. The staff was supportive. And if there's something that comes up with my kids, they were always going to be my priority.
You said something that I heard my other guest, who is the attorney, say, and that is being in a practice or in an environment where your peers are supporting you, or management is supporting you, or your coworkers are supporting you, and how important that is. And she came from a practice or a law firm that didn't, and then switched to one that did, and that was so crucial when she decided to start her family. So I'm sure making sure that you're in a place as a woman stepping into a male-dominated field, or really any job or field, that understands that a lot of us want to have families and start families, and that's a juggling act. And so there has to be understanding, there has to be time set aside to pump or take care of family needs if we need to, and that doesn't devalue or discredit the work that we're doing or make it any less impactful or important. We're just doing both. So I think it's really great to hear that for the most part in your practice you were able to do this not only once but 3 times. So talk to me a little bit, when you did decide to get into cardiology and go down this field, were you met with any barriers specifically as a woman along the way, or hurdles that you had to face that you feel like your male counterparts maybe did not?
Again, I think I felt very lucky, but I know it's there. I mean, I told one of my colleagues I was doing this show, and she brought up a ton of memories of me from my training. I probably put in the back of my mind, but if as a doctor I walk into a room with a male medical student, they're going to look to the male medical student and look to him as a doctor. And then you're kind of like, check it out. It's me. And then, again, I trained in one of the cardiology classes, which is only 6 people at their level. There was 5 out of 6 women. It is unique and not the norm because of the challenges, the time commitment, not being able to juggle it all. Most of the men I've worked with, and it's been, there are some female attendings. The attendings are the teachers in medicine, so there are some female attendings, but majority have been men, to be honest. So it's hard to find, necessarily a female role model, although I have a few now. I've had just open-minded men, liberal guys, who I still keep in touch with. One of my mentors from training, we went for iced tea the other day, and he's just a brilliant, amazing cardiology god. Like I said, the managing partner of my practice, one of the other female cardiologists who's a senior here, has definitely been a mentor and just a wonderful resource. But I mean, look, you're a pretty woman. I try to take care of myself. People are gonna first see your looks, and they're gonna make a judgment call from the get-go. Women and men do that, right? So catcalls and being, called sweetie and honey, and, it depends how you interpret that, right? How much you let it affect you. It depends how demeaning and disrespectful too, right? So it's something that I just learned to cope with, and I just let it roll off my back, or gently push back and correct, I'm actually your doctor. But for the most part, I go, and maybe it's just so far from in my past, in the rear view, but you just kind of learn to nod and smile and blow it off. And if there's really uncomfortable interactions and it's just beyond my level, I will remove myself from that situation or interactions with that person for a while.
And you're kind of offering already this advice if a woman decided to go down this path, or to your point, really any situation, right? I think we as women face this kind of communication in a lot of different scenarios. The honey sweetie thing, it triggers me. Even hearing you that sets me so off. But if there were a woman, or if I was hey, Dr. Frost, I want to get into cardiology, what kind of advice would you give to me starting down this path, knowing that I'm a woman, to kind of, in your same sense, stand up for myself, or really press forward if I may feel like I'm doubted in a room, or I feel like everybody's looking towards the man and not looking towards me? What kind of advice would you offer to just someone younger who's looking to get into this field?
Well, you just have to be confident, right? It's what I tell my girls all the time. You got to fake it till you make it. And I don't mean about knowledge. I mean just about confidence. Nobody inside is feeling super confident.
Yes.
But if you give out this air of confidence, I have a plan, I know what we're going to do, it gets you a lot further, right? But you have to practice that. That takes time. The way I speak to you, the way I speak to my patients, like, I mean, if you saw me in like middle school and high school, I was like this teeny little nothing who wouldn't want to speak in front of anybody without like my heart rate going through the floor. So it just takes time and patience and practice, right? And a little hard work, definitely hard work. But I think, you know, if you're applying as a woman, and there's a lot of fields of medicine where women are still the minority.
Right.
Surgery, for example, definitely still a minority. I talk to my poor surgical friends all the time about it. It's very obvious, but you know, they're not shy. They push forward. They find the right patients. The right patients find them. They find the right work environment. So I think that's just about it. Setting expectations for the people around you, for yourself, but more importantly, like boundaries, right? So I'm glad to hear this lawyer found a different job. I'm so lucky that this is a job I've had since I left my training in my hometown where I grew up, and I'm happy here. My family is here.
Yeah.
But it's boundaries, right? So everything has a give and take, and there's only one of you. So if you feel like it's too much on your mental and physical load, you have to find the right mix of a lifestyle. And that's just not in medicine. It's anything that you want to do in life.
Absolutely. And I love that you had touched on the confidence piece, because that's big with my personal brand. And to your point, I will always say too, confidence is a skill that you have to practice and get better at, because you're always going to feel that like little voice inside that doubts about how you show up. Knowing your truth, having the knowledge in your head that you can then deliver, like just being in that confident place, believing in yourself, knowing what you bring to the table, and not afraid to like hide that when you step into any situation is such a good way to really kind of push yourself forward. So I love that you mentioned that specifically as it relates to this role as well. You also said finding the right patients, and you had mentioned this earlier too. And so I want to come back to this. One of the other facts that I had like found when I was looking up like women in cardiology was that studies indicate that female heart disease patients have better outcomes when treated by female physicians. And that was on the American College of Cardiology website. So
I love that you found that.
I was like, that's so great. And so I love that you kind of brought it up, where you're like, there are issues that women deal with that you can understand better or relate to better, or there are women that go, hey, I want to speak to a female cardiologist. So can you give us some women's health, heart tips, wellness? What should we be doing as women to really take care of our heart, especially as we get older?
I'm really happy that you did your research. It means so much to me that you found that, because that came out like, I don't know, 5 or 6 years ago. And I've like surfed that wave for a long time.
Yeah.
Because it's not just that resource, it's in other things like U.S. News and World Report. The New York Times has all come out with the same thing, that, and this is universal, that women providers give better care and have better outcomes for their patients. And so I have many men who feel more comfortable coming to a female provider for me than they do the men, because maybe they feel more comfortable, maybe we're more open-minded. And I will tell you something, we are sure as hell, you told me it was okay to curse, sure as shit more detail-oriented than any of the men out there.
Yeah.
Right?
Yeah.
So, anyway, so I think that is why that statistic is there. I think it's absolutely true. Women care more, they delve more, they communicate, I mean, worlds
communication,
more than
right.
the men. Anyway, I digress a little bit. But as far as women health in general, I speak to a lot of people in general, and I obviously speak to a lot of women. I think that women are the quarterback of everyone's lives, right? They are the house managers. They are in charge of health and education and scheduling and socializing. Women do it all. Oh, and then we work and we take care. Yes, right. We do it all. So what results, I think, for some women is that their health, their life takes a backseat, right? And that's a problem. I love when I hear women who are coming in who are like, I know that I've like let myself go. And I don't mean like how they look, but just like, sure. I know I haven't like kept with what I need to be doing for my health. Here I am, like, catch me up. Let's just make sure everything is good. And so I think that, women, especially the middle-aged women, are taking care of their elderly parents, taking care of their children, maybe their children's children. So there's a lot of women who are stuck in between, feeling responsible for it all, right? So that's not my area of specialty, is like that mental load, the mental health, but I talk about mental health all the time in my practice because there's just no way to separate some cardiac symptoms from anxiety or their depression from their menopause. And I am comfortable and confident in where I am in my practice, and I'm not afraid to go there. I think maybe there's a taboo on mental health, and I know I'm a cardiologist, but I speak about mental health so much with my patients because guess what? If you're not motivated, if you're depressed, you're not going to be taking care of your cardiac health either. You're not going to be taking your medications or going to the gym. And so it's all intertwined. So I'm big on addressing your mental health, whether it's just with complementary things like diet and exercise or therapy or finding hobbies or getting on the right medications. I'm so big on mental health.
And I'm sure. I mean, and you're the doctor, but there's obviously a direct connection because if you're stressed, your blood pressure's up, your heart's working more. I mean, it's going to cause the issues if you're just. I mean, I can feel it myself, right? Like when I go through like a tough time or something, like I'm like, damn, I can feel physically. I'm like, Samantha, you are abusing yourself internally here. Like you got to calm the mind, and then you do a couple things, and you already start to feel better. So huge on mental health as well. So talk to me a little bit about now, just a little curious on what a cardiologist does throughout the day. Do you perform surgery too?
I don't. I am trained in one type of procedure, but I'm considered a non-invasive cardiologist.
Yeah.
I work within a practice where I have partners who do procedures. We're not surgeons, so cardiothoracic surgeons do the open heart surgeries on the heart. But we do, like I have a partner who's what's called an invasive cardiologist. He'll put stents in the heart. We have doctors who do the pacemakers and the electrical issues in the heart. We have doctors who do advanced heart failure. But as a general cardiologist, I do it all. And I'm like, again, I'm using the word quarterback, but sort of guide and address and diagnose commonly through tools that I use routinely that I'm sure you've heard about, like echoes, ultrasounds of the heart, electrical monitoring. People do at home, lots of stress testing, lots of CTs of the heart. So I will meet a patient, they'll have concerns whether they have symptoms or not, and just order a battery of studies that will help me figure out if it's really a problem, if it's not, if I can reassure them, if I need to treat something. Always looking at blood pressure, treating blood pressure, counseling all the time about healthy weight loss, exercise, the right kind of diets to be on. Because, I have to say that social media is very dangerous, and you can hear, I hear a lot of, but they say to take this kind of supplement. I'm like, who is they?
Who's they?
Right. And that, I think, is one of the biggest dangers in medicine, is taking advice from the wrong people. I did people on TikTok, again, not my generation, but I feel like when you take advice from your brother's cousin's nephew, then you're not getting the right advice, and making a medical decision to or not, or take a medication based on that, is dangerous, right? But I am the real deal. I do, I'm a boarded cardiologist. I've trained a million things. I'm up to date with all my boards and all of my credentials and everything. Like, I'm like the real deal, like Western evidence based. But there are some people who are, encouraging patients to think things that are not effective or too holistic and not the right thing for everybody.
Yeah.
I digress. But so once I diagnose somebody's conditions, my tools are medications, and unless they need a procedure. And so then I will, like I did today, I saw a patient. Unfortunately, he did not pass his stress test. It was abnormal. I have the luxury of doing some telemedicine. The patient's in the Keys, actually, so from Miami.
Wow.
I don't want to drag him up here to do that, and I'm very open to call him and say, hey, you never want to hear from your cardiologist the same day the next day is a study, but here I am. I'm telling you, again, facing difficult conversations. People do not want to hear bad news. And I have to give it from time to time, although I give good news too. Yeah. I tell patients I'm not the fun doctor, I'm not the sexy doctor. I am the doctor who's going to keep you alive longer if you take the right medications.
Yeah. You said something, and I don't want to, again, I'm not going to get too off topic, but I think this is important because you touched on it. We are living in a time where information overload is happening. And I talk about this on my workout. When I was talking about fitness, it's information overload. When you're looking at your health, which is even more important than what type of exercise you're doing, to me, it makes sense. Don't go to social media to diagnose yourself. where's the best place for people to start if they feel like something's wrong? Do you think just like a general practitioner? And then even with that, like, where do you go to get correct, accurate, most up-to-date medical advice so that you know you're getting the best care possible?
Right. Yeah, starting with the doctors. I mean, that's really where it's going to be. But I have patients who have come to me with their ChatGPT questions, and the ChatGPT says that. I'm like, but are they aware of all the other data points that you didn't put in because you didn't know were relevant, right?
ChatGPT.
Garbage in, garbage out is what I'll tell you.
Yeah.
I mean, I admire patients for doing their research. I do. I think educated coming in with questions, coming in with your data is very, very helpful. But I mean, going to like the major societies, like within cardiology, American Heart Association, American College of Cardiology, I mean, that's where I would get the guidelines that drive our practice. You know, there are guidelines within every subspecialty, and going to like the reputable major national organizations, right, like Mayo and Cleveland Clinic, like go to them for advice. Unfortunately, I see a lot of problems with people not doing it that way.
Yeah, I'm sure. Well, I think it's great advice. And again, it's like, going to the major reputable sources to get your information. But I know we're definitely living in a time where people are going to ChatGPT, or they're going to social media, or they're going to TikTok and hearing all these things. So good just to hear that confirmation from a doctor as well. Like, hey, doctors are still the best. Not that I expected anything different, but just so we're all on the same page, doctors are still the best place for info. So I'm going to circle it back a little bit more to family life, and then I want to wrap it up here. I don't want to assume, but let's say, do you ever struggle with mom guilt? And if you don't, love that. But do you ever like have trouble balancing what is the priority? And I hate saying even balancing, because some days this is the priority and some days this is the priority. But how is it working in such a demanding career and being a mom, even with the girls getting older now?
So I feel like one criteria you have to do what I'm doing is like amazing time management skills. Like, I have plans and planners for my plans, and I know my friends, and they know, they just roll their eyes. I'm like, what are you doing like May 23rd at like 3 p.m.?
She's
like,
type A.
Right?
Yeah.
So, you know, it's about, you know, I don't consider myself overly anxious, but when I'm planning, I'm like getting my anxiety out by making sure everything is ready to go. I mean, I try to do it all. I fail often, you know. But I am very lucky. My husband has more flexibility. He works from home. I have a full-time nanny. I am not a superwoman. And that advice to get a full-time nanny came from my partner, who's a female cardiologist. She's like, Lauren, you cannot do what you're doing and not have more help. And once I did that, I mean, I could breathe again. My mom, my parents are local, and my kids are lucky to be raised with them too. Mm-hmm. So like, last week it was the book fair, and I prioritized saying, I think if I can give them the money to shop, then my mom can handle the shopping. I don't need to take off time for that. Yep. But tomorrow is career day in kindergarten, and I'm going to go to that because like I'm doing here, I think I want to be a role model for little kids, especially little girls, to say, wow, if she can do it, I'm sure I can figure out a way to make it happen, you know, with the right resources and getting the right help. So I am like, time management is like my thing. Yes. But like,
amazing.
You know, it's a time and a place. So sometimes I do have to take calls. Sometimes I have nighttime responsibilities. And I'll say to my husband, look, this weekend I'm on call. You can't make other plans. Or here's the birthday party. I have coverage here. I have a babysitter here. I'm not going to be part of that weekend so much. So I can anticipate most of the time when I'm not going to be as present. And then I try to take off when the girls mostly are off of school and we're living. We're going to travel. We're going to go because, you know, I heard someone talk about, maybe you've heard about this too, that vacation memories are like really the core memories that kids have. Yeah. So it doesn't have to be major memories. It doesn't have to be like a crazy vacation, but when you are momming and you're a mom 24/7 on vacation, because I don't travel with any help, it's just, then they see it. And it's a little different experience, and it's much more bonding to be there 24/7. It's different than even being a stay-at-home mom and your kid going to school. It's like having to interact all the time. So I'm a big proponent of like taking time off and being with your kids and vacationing. But you know, I just know that I trust my people. Like now that my kids are sick from school, you know, I don't always stay home to take care of them. I provide the, you know, Motrin schedules. I check in. I know if they're too sick and they need to go to the doctor. I know if it's just a cold. So I'm very well aware of everything going on, especially now as academics get a little bit more complicated. And do not get me wrong, Sam, like I can get stressed. I am up at night late making sure that everybody in my house is taken care of, and you know, from the pets to the husband. And that's one thing I feel like is a little unfair when you're talking about these high powered positions, that I think the supportive spouses sometimes, and when there's parenting, like take the back seat too, you know. And I feel bad. My husband knows, like it's like my 3 girls and he's somewhere like towards the bottom of my priority list. I mean, I love him to pieces, but what we didn't talk about is maintaining like a healthy marriage when you are such a working person. Because I'm tired, I'm stressed. I get up and I exercise every day. I take food from home. I'm constantly meal planning for my whole family so that they're eating decently healthy food. But you know, you want the husband to still be happy and not be, you know, forgotten about. So that's another thing. Like all of these things, keeping yourself looking good and feeling good and presentable. There are so many things that have to be taken into account. But the poor husbands, they deserve a little bit of credit because they're loving, they're supportive, and you know, they're understanding and take that back seat.
I think that's, yes, shout out to the husbands who are there and support those of us who choose busy lifestyles and we're trying to make all these things happen and be a mom. And I totally agree with you on that. And you've got my wheels spinning now. I feel like I need to do a mini series on how we as women can step up and be a supportive spouse. I think so often, a lot of times when we talk about women, it's like, oh, we're taking the brunt, we're stepping into male-dominated fields and all this stuff. But we do have these amazing men out here who are supporting, or some men who are supporting us and women as they kind of take on this monstrous life. Amazing to be, you know, at the top in their careers and be a mom, and they deserve some love and attention and care too, which is so great. And I, you know, too, hearing you talk about how important it is when we as women, busy women, because I'm very busy too. I'm like, I just do a lot, and I'm relating to so much of what you say. And when I was with Cycle Bar, I was traveling all the time to go do these camps and stuff like that. So it was like, when I am home or it is time with my daughter, it needs to be focused, uninterrupted time, fun time. Like we're all in whatever we're doing. It's not a lot of like sitting around on my phone or we're just like sitting doing nothing. It's like, no, if we've got the time, let's make the most of this time, because those are the memories that she's gonna remember for so many years. So I think that was beautifully said. If you had anything you could leave us with, Dr. Frost, any final thoughts, advice, it could be, this is your last mic drop moment. What would you leave the listener with?
So I'm going to say this, and I think it kind of blurs between patient advice and advice that I tell myself, and trying to be a good leader and good role model is like no excuses, right? Like anyone could always have an excuse. The weather's bad, I didn't have the time, but those are just excuses, right? Nothing good is going to come without hard work. You've got to be dedicated. You have to, you know, no one's going to give you it on a silver platter, so you have to work hard. Excuses, I'm going to sit there and I'm going to say, really? Isn't there another way to think about this? Isn't there another way to get this done? Ask for help, and you'll be successful.
Yeah. No excuses. And that's her mic drop moment. Dr. Lauren Frost, all the way from Miami. If I go to Miami, I want to go out. I'm going to live my best life down there in Miami. Well, again, I really appreciate you taking time out of your very busy schedule to come on here. It means so much. Thank you for all of the amazing advice. And everybody who is listening, I hope you have a great day, because you deserve it.